This time around, we'll be talking about upper limb, and it's going to be done in series. It's for 200 level medical students, allied medical, and anatomy students, as well as postgraduate students who are in medical physics, biomedical engineering, and others who may find this interesting and beneficiary. My name is Nicholas Irure, an anatomist, a radiologist, and a clinical scientist. Radiographic anatomy of the shoulder is done in different views, standard views. And the three standard views are anterior-posterior, where the beam is coming from the front and the receptor or the cassette is at the back. Then the film is taken. The other one is lateral wide view, which is on the lateral side, and the third one is the superior inferior axial view, which is usually called the SI view. However, for the purpose of this video and this lecture, we'll be concentrating on the AP view. Why? Because the AP view gives more information than the other views. However, we need to know that there are complementary views, and these are internal rotation or external rotation. That is where the shoulder will be internally rotated and X-ray is being taken, or the shoulder is externally rotated and X-ray is being taken. This time around, we'll be talking about the upper limb part 1, which will be talking about the shoulder or the shoulder joint. The basic thing here is for us to teach anatomy using X-ray. This is not to make anyone a radiologist, but however, it makes teaching anatomy easier. Was all about imaging. With the in-depth knowledge of this radiographic anatomy, you will be able to appreciate the clinical significance of some of the structures we're going to talk about. This is going to come in a series, okay, and this is the first part. The X-ray of the shoulder, the first thing you will see in the shoulder and the X-ray of the shoulder is the clavicle. So yeah, it's the clavicle. And after the clavicle, you will see the scapula. The scapula together with the clavicle form the shoulder girdle. And with the humerus, they now form the framework, bony framework for the shoulder. Then we'll start with the clavicle. The clavicle has a medial end and a lateral end. The lateral end has articulation with the acromion. The acromion is the projection from the scapula. Between the acromion and the clavicle, there's a joint. This is the lucency you are seeing here, called acromioclavicular joint. AC joint for short. Furthermore, you have the scapula, okay, which is also called the shoulder blade. Okay, like the scapula, the clavicle is also called the collarbone. So the scapula has the superior border, has an inferior border or inferior angle, as it were. Then you have a lateral border, which is also called the axillary border because it's close to the axilla, while the medial border is close to the vertebrae, which is called the vertebral border. And there's other structures you can see around here. You have the coracoid process, which is a projection which is used for attachment of muscles. Then you have the cleinoid cavity or cleinoid fossa, which together with the head of the humerus form the ball and socket joint. This is the ball and socket joint. The distance you are seeing here is the ball and socket joint. The clavicle, the humerus has a head which sinks with the medial end sinking into the cleinoid cavity, and with that, the two of them now form cleinohumeral joints. This represents the head of the humerus, and the humerus has two projections. One is the greater tuberosity, and the other is the lesser tuberosity, which is usually called tubercle. Lesser tubercle, greater tubercle. In between the two of them, there is a intertubercular groove, which is also called bicipital groove. Why? Because the biceps the long edge of the bicep pass through this groove. Okay, and if we go further, we'll see that immediately after the head of humerus, you have the shoulder neck, the neck of the humerus. Okay, that is the anatomical neck. Then you go further down, you have the surgical neck. The surgical neck is called the surgical neck because it is one region that is easily fractured. So most fractures of the clavicle or the humerus usually occur at the surgical neck. One thing I have not mentioned is that the greater tuberosity or tubercle has attachment with the superior and inferior spinal tools, while the lesser tubercle has attachment with the scapularis. And together with the deltoid muscles, they all form the rotator cuff muscles. Furthermore, we have the shaft of the humerus, or the proximal end of the humerus. That's what we're seeing now, and as the diaphysis, and it goes further down. This arrangement is for specific reasons, and especially for the functionality of the shoulder joint, because the shoulder joint itself it's very mobile. The ball and socket joint, you can move and rotate in all directions. That is why it is called the ball and socket joint. However, in all of this, it is to make us know the structures, what we have studied in anatomy, cadaver, gross anatomy will find it easier to we appreciate that in the radiographic X-ray, and that is why this is being taught using the X-ray. So, and I think by now I will have been able to make the X-ray or the anatomy of the shoulder a bit simple enough for most undergraduates to follow. Well, if you have any questions or comments, you can leave it in the comment section. And remember to turn on the notification button, like, share, and subscribe. This is just going to be one of the series of videos we'll be having on anatomy of the upper limb. Thank you.